Hello, my name is Ken Cutbush. I'd like to talk to you about the risks associated with an open Latarjet procedure. A Latarjet procedure is where we take the coracoid process to the front of the shoulder to stabilise the shoulder for someone who's having recurrent multiple dislocations of an anterior type. Now, in terms of open Latarjets, I'd like to talk to you about 3 studies that deal with this issue. If you scan the QR code, it will take you directly to the publication. If you talk about Davey et al., 2024, they looked at several studies that have been published and with a total of 313 patients, and they saw a recurrence rate of 7.7% with a non-union rate of 7.7%. So something significant to think about. The bone of the coracoid needs to unite to the glenoid. The two of them need to become one bone. Shah, 2012, this was a paper from one institution. They looked at 47 patients. This was in conjunction with Professor J.P. Warner, and they found a 25% complication rate. They were looking pretty closely for complications. They had a recurrence rate of 8% of dislocation. They found temporary nerve injury in 10% of patients. They said they all did eventually recover. There were a couple of patients that took quite some time for the nerve injury to recover, but nevertheless it did. And they reported a 6% infection rate, which does seem a little high. Greaser et al. In 2013 published a systematic review. They looked at 45 previous scientific publications dealing with this issue, and they reported a complication rate of 30%. I think that reflects to some extent the diverse group of publications they were looking at. They had a dislocation rate of 2.9% and a 5.8% subluxation rate, so almost a 9% rate of recurrent instability following the surgery, which is quite high. They had a non-union rate of 9.4%. Nerve injury they found in 2% of patients, so that's 2 in 100. And the infection rate was less than 1%. So the Latarjet procedure certainly is an operation that has significant risks that you do need to be aware of, and that should give you a broad overview of potential risks that could be considered. Thank you for listening.